Hello, today my presentation is going to be over lower back pain, and my name is Ashley Wells, and this is for NU 540 Clinical Management with Dr. Crystal White. And today's objectives are going to include discussing risk factors, discussing pathophysiology of lower back pain, identifying clinical manifestations, discussing the diagnostic criteria, and identifying guideline-based recommendations for treatments. To start off, we're going to discuss the risk factors for lower back pain. First off, age plays a factor in lower back pain. So people over 30, they're more likely to experience lower back pain. Vertebrae discs, they typically wear away with age. And as the discs weaken and wear down, the pain and stiffness can result from it. Then we have weight. So people with a BMI greater than 25 are more likely to experience back pain. The excessive weight puts pressures on joints and disc, and this increases the pain. Also, when you gain weight in pregnancy, it can put pressure on your lower back and cause pain. Poor core strength. So weakened abdominal muscles can't properly support your spine, which can lead to back strains and sprains. And overall health, people who smoke, drink excessive alcohol, and or get limited physical activity, can have higher risk of back pain. And then a huge red flag, like your occupation and hobbies. So jobs or hobbies that require like heavy lifting or frequent bending, they can increase your risk of a back injury. Lower back pain is also very common in athletes. And lastly, the one that I was a little surprised on is mental health conditions. So there is studies out there that show that there is a connection between depression and lower back pain. It's really difficult to tell for sure if depression can cause the back pain. So I found that really interesting and wanting to include it. So in practice, we hear a lot about lower back pain. It's a diagnosis that we see a lot. We know the location of it, but what exactly is the patho behind it? And according to Hills 2025, the pathophysiology of mechanical lower back pain remains very complex. Multiple atomic structures and elements of the lumbar spine, which includes bones, ligaments, tendons, disc, muscles, are all suspected to play a role. Many of these components of the lumbar spine have sensory innervation that can generate these signals representing responses to tissue damaging stimuli. Other causes could be neuropathic, which an example is sciatica, which we see a lot. Most chronic lower back pain causes are most likely involved with mixed nociceptive and neuropathic etiologies. Clinical manifestations. So with lower back pain, it can range from a mild muscle ache to a stabbing, shooting, burning, sharp sensation. And the pain can radiate down the leg, and that is very commonly seen in sciatica pain. That was discussed in the patho on the previous slide. Bending, twisting, lifting, standing, or walking can be made worse. So how do we diagnose lower back pain? So one of the most common is an x-ray. These images, they can show arthritis or broken bones, but the images alone won't find conditions that affect the spinal cord, muscles, nerves, or disc. Next, we move on to an MRI or a CT scan. So these scans, they can generate images that can reveal herniated disc or problems with your bones, muscle, tissue, tendons, nerves, ligaments, and blood vessels. Blood tests. So when we say blood test, we're just trying to determine if there is an infection or another condition that could be causing the pain. And then nerve studies. Electromyography, which is EMGs, they measure the electrical impulses produced by nerves and how the muscles respond to them. So these tests can confirm pressure on the nerves caused by herniated disc or narrowing of the spinal canal, which that's called spinal stenosis. And I kind of just put an image here that shows what a herniated disc looks like on a scan. All right, so guideline based recommendations for treatment. So, first, we're going to start with the NSAIDs. We can have therapeutic exercise, which we can refer them to physical therapy to receive those kind of exercises, or we can give them some in office to take home. Most people just want to take it easy, rest. Actually, staying active can help with lower back pain. Spinal manipulation, which chiropractor can help with that. And then acupuncture was stated, but with the acupuncture, it's more utilized for people with chronic lower back pain. All right, and now to the case study. So, Alex is a 40-year-old female who presents to the clinic today with a chief complaint of lower back pain. She describes the pain as sharp, shooting pain that radiates down her left leg. Upon assessment, she rates the pain as 8 out of 10, denies any injury to the area, but states she was picking up large boxes 2 days prior at her warehouse job. Her history includes hypertension, obesity, and type 2 diabetes. Her vitals are as stated: heart rate 89, blood pressure 156/78, oxygen 96%, temperature 36.7 Celsius, and BMI is 28. Now with the case study questions. So, what are Alex's risk factors for lower back pain? What type of testing would you order, if any? And what recommendations for treatment would you offer Alex? And here is my concept map and my references for the presentation. If anybody has any questions, feel free to reach out to me at ashley.wells@smnw.edu. I'll be happy to answer them when I get them. All right, thank you for listening. I appreciate your time.